A typical day in the hospital could entail long waiting hours for medical care and in-person interaction with a doctor, but those days are gradually being phased out with the new reality brought by telemedicine. Patients and doctors can now meet remotely via video and app-based visits, and that's where Ugochukwu Chikezie comes in. The Nigerian with his team has developed a mobile application that can connect patients with licensed doctors. The platform, Tremendoc, was born out of a need to provide a convenient way to receive medical support and bridge the gap between doctors and patients.
I also have a story about my son who was diagnosed with enlarged adenoids, and what that cost was he always had a stuffy nose or blocked nose in the middle of the night, and would force us to drive him to the hospital 2 a.m. in the morning, 3 a.m. in the morning, or call the family doctor. And then it hit me that there were a lot of Nigerians who didn't have that kind of access. And even if I could drive at 2 a.m. in the morning, I was still keep putting my family at risk. And those things combined just brought the idea to me that why don't we have a mobile app that could give people access? Because some of these things might not even be emergency things. It could just be just an assurance from a doctor. And that's how the marriage happened, and that's how the vision was born.
Available statistics from the World Health Organization show that over 40% of WHO member states report to have less than 10 medical doctors per 10,000 population, and over 26% report to have less than 3. In Nigeria, it is revealed that the physician-to-patient ratio is 4 doctors per 10,000 patients, an alarming low rate, especially for a country struggling to provide medical assistance to its citizens, which is why the health tech startup is changing the way patients seek care. Via the app, patients can access quality healthcare services regardless of their geographical location from the comfort of their homes. And this limits visits to hospitals and healthcare centers, especially in the wake of the COVID-19 pandemic.
Tremendoc is a telemedicine solution. It's a solution that allows, it's a mobile app that allows patients or users talk to doctors remotely, whether it's via chat, audio, or video calls, 24/7. We've been able to aggregate doctors across Nigeria, and they can consult with patients remotely. So, meaning a doctor in Cross River can consult with a patient real time in Lagos or Port Harcourt.
Merging healthcare with digital technology was one thing, but convincing the doctors to join the wave was another.
In the beginning, it was a bit tough because there was a lot of education to be done with doctors. Even doctors themselves didn't understand how it was possible to give a proper diagnosis and treatment to patients remotely. But one question I used to ask when I was talking to doctors to come up on the platform was, I said, have you ever had to, have a conversation with your brother or your sister or your mom or your wife or your friend over the phone because the person is saying, oh, I feel this way, what do you think is wrong with me? And 100% of the doctors have had that experience. I mean, someone actually told me that if she was getting paid for each time she had to talk to somebody about a sickness or prescribe something, she would have been a millionaire in dollars today. It was a joke, but the truth is, what I said after I got that response was, you've been practicing telemedicine all this while.
And working with Tremendoc has been quite impressive to see the amount of people that are embracing telehealth. And telehealth basically is providing healthcare services to individuals in lieu of in-visit consultation, so that you have people that you get to provide services through electronic media, software, or apps. Physical visits, I think some of the major things that can also be done virtually, because you can still, sometimes we do video consultations, you can see the patient, but there's still some limitations, however, in terms of, getting some physical examinations being done. Also, as a doctor, you should be able to tell when this patient has more serious symptoms and needs to see the doctor, because we have a lot of patients before telehealth seeing the doctors or over mere symptoms that can actually be handled over the phone. So I think it has somewhat brought some prevention and limited the spread of this coronavirus.
Ugochukwu says although the telemedical platforms are siblings to traditional healthcare systems, they face the same troubles or the tech startups struggle with.
I think the biggest challenge is education, actually, because from a doctor's end, there's that educating to be done, and then also the patient's end. I think the pandemic actually helped in educating people because they were forced to look for an alternative if they couldn't go into the hospital. And once you try it, you would realize that it actually works. Telemedicine is facing the same thing every other startup or any new thing faces here in Nigeria, from funding to government structures and so many other things. I think it's a general thing amongst different companies.
As the platform seeks to change the narrative of how people access healthcare in Nigeria, it is another way to show how much technology is revolutionizing sectors in the world today.